Last paper is by Dr. Bindu Ajit. BHEX in complicated situations in cataract surgery.
Good morning, everyone. I'm here to talk on BHEX in complicated situation cataract surgery associated with glaucoma. So when you're doing phaco in a glaucoma eyes, we are faced with much challenges. It can be a post-trap patient where the pupil is not dilating. It can be a small eye with a bulky nucleus with less space to operate. Or it can be a patient with total sine cave, the secondary glaucoma, or a pseudoexfoliation patient with a rigid pupil and also with unstable lenses. So we have multiple devices, the iris hooks, the Malyugin ring, and in glaucoma patient, if you are using iris hook with multiple incision, we always face the issue of forming the AC and multiple leaks. And Malyugin ring is a little bit more bulky with an special instrument to insert it, and it has more rigid contact with the pupil. But here, in the aim of the study is to analyze the utility of BHEX pupil expander in cataract surgery through small pupils in associated with glaucoma having less working space. This is prospective interventional case series done in 17 cases where the pupil diameter was, after dilatation was less than 4 millimeters, eyes with pseudoexfoliation, post-uveitic, posterior sine cave, post-trabeculectomy, and senile meiosis with having shallow antechamber were included in this case. And routine phacoemulsification was done. If the posterior sine cave is present, synecholysis was done. And after injecting the viscoelastic, a BHEX pupil expander, a third generation Bhattacharya ring, is a flexible jointless hexagonal ring which is introduced and to engage the pupil margin and removed using a BHEX forceps. This is a video. There's a case of a post-repeat trap where the pupil is small and the the synecholysis is done, and then the BHEX is introduced through the same phaco incision. There is no additional incision required. The flanks are so thin that it is very easy to insert under the iris. Though we have less working space, it is possible with this. And then after that, we can do the routine phaco surgery. And after the implantation of the lens, it's also easy to remove the BHEX ring. So especially in cases where the anterior chamber is very shallow and a bulky lens, this comes very handy. And this is a case where pseudoexfoliation cataract associated with a subluxated and unstable lens. And when we need to have an additional device like CTR, we have less space when you're using other expander like the Malyugin ring, but with a BHEX we have enough space to introduce even the CTR under the iris. Under the, like go under, there's enough space between under the iris and the this is the introduction of the CTR. And you get better visualization of the lens margin, and less manipulation of the lens. Already the lens is unstable, so you get better results of your surgery. So after the introduction of the CTR, you continue with your phaco, and then we can avoid complications. So in our series, we had 17 patients. We had stationed the device before performing the capsular rhexis. The average age of our study was 71 years. Out of the 17 cases, 10 were male and 7 were female. This is the demographic. We had 5 cases of pseudoexfoliation, 3 of uveitis, and 7 patients with senile meiosis, with shallow anterior chamber, and 2 with post-trabeculectomy. The other systemic causes which could attribute to the small people, diabetes was in 6 patients, and patients with alpha agonist were 3. And because it is adjuvant to a cataract surgery, definitely we had a visual improvement post-operatively also, which is statistically significant. So the pupil size after the surgery, post-op pupil diameter on average was 1.78 millimeter. So the patient did not complain of glare or did not have any case of persistent pupillary distortion of the surgery. And the intraocular pressure was also only 17.25 on an average on follow-up. So on discussion, small pupil phacoemulsification, we have challenges and we have increased inflammation, PCRs, increased rates of PCRs, vitreous loss and anticapsule tear and retained lens matter, especially so in diabetic patients and with medications and the floppy iris syndrome. So here, initially which we sphincterotomies which can cause glares. Now we have more demanding patients with, though they have subluxate lens and so small pupil, they ask for this premium lenses and toric lenses. So these devices help us to offer these patients that also for us. And in our country where we have more of angle closure glaucoma and more bulky lens for coming for phacosurgery, this comes handy. Because BHEX is a uniplanar design, it is flexible, thin profile, it can go through a small incision and it is less space occupying. There are other studies which support this also. Initially it was the first generation which had problems with breaking of the ring, but now with the recent third generation we don't have much problems. And these are the study which compared all the pupil expander devices and found that all were, the difference between them all were no any statistical significant difference in all the devices, but they also did a corneal endothelial cell count which we did not do. So and the price factor is also with Malugen, the patient had to pay an extra 6,000. With BHEX, it's just 2,000 rupees. And we also found that it could be ETO'd and reused. So definitely this gives more advantages to our patients. Thank you.
This all, how many cases were
17 cases.
Oh, ankle closure?
No, angle closure was I think 7.
7, okay. So the comparison, there is a difference in group actually, no?
So all difficult cases
Okay,
in
you are
glaucoma which I used BHEX.
So, compared to the angle closure cases, did you find any additional difficulty in those cases as compared to the rest?
Yeah, definitely. I have a video where there is a lot of positive pressure and your difficulty in doing. But since this is a very thinner one, the Malugen gives you more trouble when you're doing phaco. But since this is more thinner, though we have difficulty when compared to the open angle, but with the BHEX you can do it much better than with the Malugen. That is what.
So do you think the disadvantage of having to open your main incision prior to doing a capsulotomy in a angle closure glaucoma, do you think the benefit of the ring outweighs the downside?
I'm a surgeon who does rhexis through the main ports in all cases.
Okay.